Hello, I'm Dr. Marla Shapiro, and I'm professor in the Department of Family and Community Medicine at the University of Toronto, and I sit on the Board of Trustees for the North American Menopause Society. I'm joined by a very familiar face, Dr. Peter Schnatz, a former president of the North American Menopause Society, who is the Associate Chairman and Residency Program Director of Obstetrics and Gynecology at the Reading Hospital in Reading, Pennsylvania. So let's start with a concept that's come out recently, the concept of timing and window of opportunity and this timing hypothesis. Should clinicians be starting their patients on hormone therapy the moment they become symptomatic, or should we be waiting?
Yeah, and this is a topic that we've been learning a lot about and talking a lot about. And there really seems to be a big difference in terms of when we start. In the old days, we used to just kind of think of hormonal therapy as a one-size-fits-all. Is it good? Is it bad? It doesn't really matter when you start it, but there really does seem to be a big difference.
So what is the difference?
Well, most of the time, historically, we usually start medication on patients at the time of menopause because they're having hot flashes or vaginal dryness or symptoms. Some of the studies that were done were looking at other indications. Should we be using it for chronic disease prevention? And in those studies, some patients were well beyond the time of menopause when the hormones were started. And now as we kind of go back and look at the difference of what are the outcomes for women who started closer to menopause, younger in age, versus those who are older, further from menopause, the risk-benefit balance seems to really shift dramatically, much more towards a more beneficial, healthier outcome in the younger, healthier women closer to menopause, and then starts to shift in a more negative direction further away from menopause, so that timing hypothesis.
So in that timing hypothesis, is it in terms of as women get older, they are getting more vessel disease, for example, from a cardiovascular point of view through the process of aging, and then hormones work differently on that type of vessel than a vessel that is younger and healthier?
Right, that's a big part of what we believe. Now you have to understand and remember that the vessels are surrounded by estrogen receptors, and as the vessel becomes diseased and plaqued, those receptors are lost, and the effect of the estrogen on the vessel is very different.
So for a woman who is young in terms of this timing hypothesis, who has intractable hot flashes and night sweats, what do we see from a cardiovascular point of view compared to a woman who's coming in her later 8, 9, 10 years into menopause, been suffering all this time, but now feels that she wants therapy? Are they both candidates?
Right. Now you also have to remember there's two things we're talking about here. Treatment of symptoms, and there are approved indications for the use of hormonal therapy. Hot flashes, vaginal dryness, prevention of bone loss, and hormones have been shown to be extremely effective in those indications. The other is, does it cause a benefit, does it cause a harm for many of these other outcomes? None of those outcomes are indications to use hormonal therapy. It's information that we need as we counsel our patient. So yes, in the woman younger, closer to menopause, having symptoms, there seems to be, clearly it's safe, but is there some potential benefits? There may be some benefits. We're not going to use it for that indication, but it's going to help us to reassure our patient that not only is it safe, but there may be some other benefits that come along with that.
And for an older woman who's in her 5th or 6th year into menopause, has been struggling with over-the-counters and just delaying coming to see their physician seeking guidance, finally does come in seeking guidance, is it too late for her to start?
You know, it's hard to know. There isn't a set time where you can never start it. And you also raise there's some debate about the symptom of hot flashes. Does the fact that a woman's having hot flashes imply that her vessels are still healthy? They're able to vasodilate in response to the estrogen and healthy endothelial function and so forth. And some people would argue, even if you're 10 or more years out and your vessels are you're still having hot flashes, maybe your vessels haven't become plaqued and diseased. But most of the data shows that within that 10-year window, younger than age 60 or 10 years from the time of menopause, that there's a much healthier risk profile.
Thank you so much.
Good to see you.